There are cardiac medication every nursing student should know for clinicals and for the NCLEX. Are you preparing for your NCLEX or are you still in nursing school? These are 6 cardiac medication you want to know. Let's make it simple. So today I'm going to break down all the key 6 medication at least you must know to help you in your clinical or NCLEX if you're preparing for that. The first medication is a beta blocker. They have a last name as LOL. So you can see example is metoprolol, atenolol, propanolol. They bind to beta receptors. There's one beta receptor on your heart and there's 2 on your lung. Therefore, you can see that these medications can affect your lung and your heart. So we have selective and non-selective. Selective means if you're targeting your heart, then you pick something that will target your heart. If you're targeting your lung, you should pick something that will target your lung. But if you don't you pick a medication that is non-selective, it will bind to both. Since it's going to block these receptors, which are beta receptors that speeds your heart up or increase your blood pressure. If I block those receptors, I'm going to slow down your heart rate and I'm going to lower your blood pressure. Therefore, it's very good for hypertension. If you have a heart attack or MI, we can use that to slow you down as your heart is recovering. But sometimes too much, if you have heart failure and you have decompensated heart failure, that means your heart is completely dead. We cannot give you a beta blocker. It can also be used for arrhythmia. Your heart rate is going too fast. Tachyarrhythmia, we can slow you down like atrial fibrillation. Because it slow down your heart rate and your blood pressure, you should check those parameters before you give it to a patient. Like holding it when your blood pressure is less than like 90, right? Holding it when your heart rate is less than like 60. Since it can block B2 receptors on your heart, on your lung, therefore be careful in asthma patient or COPD. It leads to what? Bronchospasm. So pick a selective one. If you pick non-selective, it's going to cause problem. How do you know which one are safe in asthma? In a beta blocker, that starts with the B. Bisoprolol is good. It's safe in asthma. A. Atenolol is good. It's safe in asthma. M. Metoprolol is safe in asthma. Therefore, BAM, BAM is safe in asthma. So any beta blocker that starts with the B, A, and what M is safe. Mnemonic, be careful. Beta blocker, block the beat. That's your heart. The next medication you should know is angiotensin inhibitors. Angiotensin inhibitors usually start, we call it ACE inhibitors with the last name what? P-R-I. And what do they do? Example is what? Lisinopril and enalapril. They block angiotensin 1. Angiotensin 1 is part of the earliest pathway that will finally lead to production of what? Aldosterone. And this aldosterone will increase what? Your sodium and that retain fluid and increase your blood pressure. If I block angiotensin 1, you're not going to have aldosterone. And if you don't have aldosterone, your blood pressure is going to decrease. Another thing too, if you don't have aldosterone, potassium goes up. Therefore, these medications are very good for what? Hypertension. It can also cause hyperkalemia. In the process of blocking angiotensin 1, it leads to what? Production of bradykinin, which causes what? Cough and angioedema. The increased level of what? Bradykinin lead to cough and angioedema. Because of these side effects, if patient is taking ACE inhibitor and they're having these cough symptoms, we change it to ARB, angiotensin 2 receptor blockers. It does not block angiotensin 1, it blocks angiotensin 2. In the process, it decreases the level of bradykinin and that does not cause cough. Know them, very good. Another thing you should know about ACE inhibitors is it causes angioedema, it can cough, it's also teratogenic. So if you're pregnant, you cannot take it and lead to hyperkalemia. Next medication is calcium channel blocker. Most of them will end with PIN, amlodipine, nifedipine. If the NCLEX does not give you the PIN family, it will give you these two weird ones. So know them, diazam or verapamil. They block calcium. Calcium is responsible for contraction. If you block it, it relaxes the smooth muscle. This makes your vein bigger and you retain blood there, and it decreases your blood pressure. It can also slow down your heart. Therefore, we can use it for hypertension, angina, and maybe arrhythmia. In the process of making your vein bigger, it can cause edema, flushing. These are all expected findings. It can also cause headache. It can slow down the smooth muscle, causes constipation. So those are things you have to know. The major side effect is mostly bradycardia and slowing down your heart rate, but the other ones is expected. No bad signs and symptoms. One thing you should teach the patient, have a grapefruit juice. The other thing you should know is they comes in as extended release. Therefore, you cannot crush it, you cannot chew it, you cannot put it in an NG tube. Mnemonic, it calms the heart down, slow the rate, and lower your blood pressure. The next medication is loop diuretic. They affect sodium potassium channel exchange in the loop of Allen of the kidney. Example is furosemide, bunitimide, and what? Etracranic acid. What do? They change your potassium level. They lead to sodium loss. In the process, you take away fluid from the individual. The major side effect, even though potassium and sodium are decreasing, it leads to a lot of potassium loss. So they have hypokalemia. That's the priority side effect. And so look for cramps, right? If a patient is on this medication, tell them to eat fast. Fish, avocado, strawberry, and tomato. If you give it too fast, it causes ototoxicity, hearing problem. So slow it down. You should monitor their heart rate, their urine output, and their electrolyte. One thing you should know is most of them are sulfur drug, except etacranic acid. Since they are sulfur drug, it causes photosensitivity and what? Stevie-Johnson syndrome, which is number one. It's a priority. It's a safe sepsis, and you have to be sharp when you see that. So always give it slowly, but know if they have sulfur allergy, you cannot give it to them, except etacranic, the sulfur allergy level is very low, so you can give it to them. But furosemide, sulfur drug, causes Stevie-Johnson syndrome. Digoxin is big. Digoxin is big. Digoxin is big. You should know about it. You can use it in heart failure or cardiac arrhythmia. If it affects sodium potassium channel in your heart and other places, it slows down your heart rate. It increases your contractility. So this is a little bit confusing. It slows down the heart rate, but it helps your heart contract very good. That's why we can use it in heart failure. The major side effect is GI symptoms, but it has other side effects, vision changes, confusion, kidney, heart block. But if they give you in the nursing school or in the neck on the ankles, look for GI symptoms, nausea, diarrhea, vomiting, because the early side effect is nausea, GI symptoms. So that is the one you should worry about. There's another thing you're supposed to do. If the apical pulse is less than 60 in adult, hold it. Less than 70 in the young kid, hold it. Neonate, 90, hold it. Potassium level, don't decrease it, don't increase it, but maintain it normal. That is the trap. Don't increase your potassium, don't decrease your potassium, maintain it normal. Therapeutic is a narrow therapeutic range, so be careful. The last one is nitro. You got to know this, baby. This is key because a bunch of people have had problem. They will trap you with a lot of side effect. Know the three forms. It can be sublingual. It can give it through IV or transdermal as a patch. Know how to teach the patient. It does not like sunlight. Keep it in the container. Don't remove it. It's away from sunlight, not in the glove compartment. You can take it every 5 minutes when you have chest pain. But the key is after the first 5 minutes, call 911. Take the second one, take the third one while you're waiting. Don't wait till the third one before you call. It causes headache. Therefore, you can lay down or take some Tylenol. But don't cut it, don't destroy it, don't put anywhere that because you have headache, you stop it. Flushing is normal, edema is normal. You cannot combine it with any nitrate like sildenafil, erectile dysfunction. If you see a patient with erectile dysfunction and taking nitro, priority. Six medication, you got to master them for your NCLEX and for your nursing school. Good luck. Thank you.